As we know, diabetes is a chronic metabolic disorder that is characterized by elevated blood glucose levels due to inadequate insulin production, resistance to insulin action, or both. In the earlier era, we didn't have much information about diabetes. We knew only two pathogeneses for diabetes. Then we came to know about the ominous octet means 8 pathophysiologies for hyperglycemia. And now, as per recent updates, there are more than 12 pathophysiologies found to be involved in hyperglycemia, diabetes. Beta cell dysfunction. Beta cells in the pancreas are responsible for producing and releasing insulin, which helps to regulate blood glucose levels. In people with diabetes, the beta cells may malfunction and fail to produce enough insulin, leading to hyperglycemia. Alpha cell defect. Alpha cells in the pancreas produce glucagon, which raises blood glucose levels. In some people with diabetes, the alpha cells may be overactive, leading to increased production of glucagon and higher blood glucose levels. Adipose tissue dysfunction. Adipose tissue, or fat cells, play an important role in regulating glucose metabolism. In people with obesity-related diabetes, adipose tissue may become resistant to insulin, leading to insulin resistance and hyperglycemia. Skeletal muscle dysfunction. Skeletal muscle is a major site of glucose uptake and utilization. In people with diabetes, skeletal muscle may become insulin resistant, leading to reduced glucose uptake and hyperglycemia. Liver dysfunction. The liver plays a key role in glucose homeostasis, producing glucose when blood glucose levels are low and storing glucose when blood glucose levels are high. In people with diabetes, the liver may produce too much glucose, leading to hyperglycemia. Kidney dysfunction. The kidneys play a role in glucose regulation by filtering excess glucose from the blood and excreting it in the urine. In people with diabetes, the kidneys may become damaged and less effective at filtering glucose, leading to hyperglycemia. Brain defects. The brain is involved in the regulation of glucose metabolism, and abnormalities in brain function may contribute to the development of diabetes. For example, some studies suggest that changes in the hypothalamus, a region of the brain that helps to regulate appetite and metabolism, may be involved in the development of type 2 diabetes. Gastrointestinal tract defects. The gastrointestinal tract is involved in the regulation of glucose metabolism through the secretion of hormones such as glucagon like peptide 1, GLP-1, and gastric inhibitory peptide, GIP. In people with diabetes, abnormalities in the secretion of these hormones may contribute to hyperglycemia. Inflammation. Chronic low-grade inflammation has been implicated in the development of insulin resistance and type 2 diabetes. Inflammatory cytokines, such as tumor necrosis factor alpha, TNF-alpha, and interleukin-6, IL-6, may impair insulin signaling and contribute to insulin resistance. Immune dysfunction. Type 1 diabetes is an autoimmune disease in which the immune system attacks and destroys the beta cells in the pancreas. This leads to a complete deficiency of insulin and hyperglycemia. Pancreatic amylin, IAPP, defect. Amylin is a hormone that is co-secreted with insulin by beta cells in the pancreas. In people with diabetes, amylin may be deposited in the pancreas, leading to beta cell dysfunction and reduced insulin secretion. Stomach or small intestine are both defects. The stomach and small intestine play a role in the absorption and metabolism of nutrients, including glucose. In people with diabetes, abnormalities in gut function may contribute to hyperglycemia. Hyperglycemia, or high blood sugar, can occur due to various reasons beyond the pathophysiologies of diabetes and the additional causes mentioned earlier. Some of the other possible causes of hyperglycemia are stress. Physical or emotional stress can increase the level of stress hormones, such as cortisol and adrenaline, which can raise blood sugar levels. Medications. Certain medications, such as corticosteroids, some antidepressants, and some medications used to treat HIV/AIDS, can raise blood sugar levels. Infections. Infections, such as pneumonia, urinary tract infections, and skin infections, can cause a rise in blood sugar levels. Hormonal disorders. Hormonal disorders, such as Cushing's syndrome, acromegaly, and hyperthyroidism, can cause high blood sugar levels. Pancreatic disorders. Disorders of the pancreas, such as pancreatitis or pancreatic cancer, can affect insulin secretion and lead to hyperglycemia. Trauma or surgery. Physical trauma or surgery can cause stress on the body, which can lead to a rise in blood sugar levels. Obstructive sleep apnea. Obstructive sleep apnea, a disorder in which breathing repeatedly stops and starts during sleep, can cause a rise in blood sugar levels. It is important to identify the underlying cause of hyperglycemia to effectively manage the condition. In summary, diabetes is a complex disorder with multiple pathophysiological mechanisms involved in its development and progression. Understanding these mechanisms is important for developing effective prevention and treatment strategies for diabetes. For more info, please like, subscribe, and share it.